Hello, I am Dr. Soumya Swaminathan, Director General of the Indian Council of Medical Research and Secretary of the Department of Health Research, Government of India. I am basically a pediatrician by training, having done my MD at the All India Institute, and I have worked all my life on tuberculosis and TB HIV interactions at the National Institute for Research in TB in Chennai, and I took over as DG ICMR in August 2015. South-South collaboration in health is very important for a couple of reasons. Firstly, most of the research and development that occurs in the area of health tends to occur in the Western or the developed world and industrialized countries, and the priorities are different. Whereas in the South, we share a number of common health priorities, particularly in the area of infectious diseases, in the area of maternal and child health, and also in the area of environmental health, and now more with the non-communicable diseases. Therefore, we have shared interests and shared goals. The other aspect, of course, is that in the South, we tend to work in at lower cost. There's less funds available for R&D. We learn to do things, with less resources. So, in that sense, a South-South partnership would enhance the investment into R&D by sharing the costs, by minimizing the risks, and ultimately we may have a win-win situation because we can also share the benefits. The Prime Minister of India last year had a major outreach to Africa with the India-Africa Summit took place in November 2015, and 54 heads of state from Africa came to New Delhi. We thought that in the area of health, that ICMR should take the lead in partnering with Africa in trying to address issues of common interest to us, and therefore this meet is really bringing people who are heading health agencies, science agencies, medical research agencies, as well as some ministers of health from Africa to discuss with leading Indian scientists, medical researchers, doctors, as well as industry representatives on how we could work together in a couple of different areas. So, we are looking at three pillars really. The first one is education and capacity building and training, whether it's for doctors, nurses, technicians, lab people, scientists. The other area is collaboration in health research, as I mentioned, in the areas which are of common interest to Africa and India. And the third is commerce, industry, especially to do with pharma, to do with manufacturing capabilities, and also some harmonization of regulations. India has a lot of scientific and technical capabilities and infrastructure in the areas of any area of technology. You take computational biology, you take bioinformatics, molecular biology, genomics, and so on. So, here's an opportunity for us to work with our African colleagues to build those similar kinds of centers of excellence in Africa, where more insights into human diseases can be obtained by applying the latest technologies, and also through these partnerships and collaborations we can compare African and Indian populations and look at differences in disease pathogenesis as well as response to treatments, biosignatures, biomarkers, and so on. The areas of collaboration that we would like to partner with Africa on, I think will become clearer after this India-Africa Summit, because this is exactly what we are going to discuss. But I can see a lot of common areas, you take in the infectious diseases, TB, malaria and HIV are all big public health problems both in Africa and in India. We have done very well in terms of say polio elimination, and also in getting rid of neonatal tetanus, and in yours we have a very good surveillance network. So, we could also work on the emerging areas like antimicrobial resistance, and how do we set up surveillance systems for Africa like we have done in India. And finally, there is the whole area of health systems, and I think that's somewhere where some African countries have got models which have been shown to work very well, in terms of task shifting in remote areas where we don't have doctors, and also in terms of using community health volunteers to deliver a lot of services. In India also we face situations in many parts of our country where there's shortage of doctors, shortage of specialists, and so we could possibly learn from the experiments in Africa and try and adapt those to India. So I see it as a two-way mutual learning exercise. There have been many studies that have taken place in Africa and India simultaneously in the area of neonatal and child health. For example, we've had trials of vitamin A, for example, that have been done in parallel. There have been studies in TB that have been done in Africa and India, but these have been, I would say, a little bit isolated incidents. And so what we're really looking at now is how can we build a strong foundation and a platform for collaboration so that it's sustainable, it's forward looking, it's inclusive, and it really adds to scientific knowledge globally. ICMR has had a very long history of collaborations with science agencies in many different countries. We have MOUs with about 50 odd research agencies in Europe, North America and Latin America. We do have a few partnerships with African agencies, but I think that it's an area that's largely been neglected, and that is where now we want to really step in and fill that gap and want to offer a hand of partnership, a hand of friendship to Africa in order to develop much more strong ties. So if you look at global pandemics now, in the last few years or decades, we've seen avian influenza, we've seen swine flu, we've seen MERS, we've seen SARS, we've seen more recently Ebola, and now Zika. Diseases are becoming global. You don't know what's going to emerge where, but most of the diseases now in the future are likely to emerge from Africa or Asia. I mean, that's also home to 1/3 of humanity's population, and also these are countries where animals, humans, birds all live in close proximity, and we know that many of the infections that are likely to emerge now and which have pandemic potential are likely to emerge from animals or birds, so zoonotic diseases. And therefore, I think this is an area where India and Africa can play a lead. We need global partnerships to address diseases like this. It's very difficult for one country to do everything necessary. Take Zika, for example. You have now global enterprise working to develop Zika vaccine, including Indian companies, and Zika therapies. During the time of Ebola, the world came together to try and develop Ebola therapies and Ebola vaccines, but we were found that we were unprepared and we took too long to react, and by that time thousands of people had died of Ebola. So I think with that history, I think what we need to work towards is a system where we've put in place the capacity and the infrastructure and the human resources which are well trained to be able to react to a pandemic or an epidemic very quickly, in terms of of course, how do you manage the patients, how do you contain the infection, what kind of facilities do you need, how do you bring in trained people onto the site, but also importantly, how do you start doing clinical trials, how do you start doing research in the middle of a epidemic where people are dying. We need protocols to be made beforehand, we need the manufacturing capacity, we need also the regulatory mechanism to get rapid approvals through ethics committees and through our drug regulators, so that you can actually start the clinical trials when they are much needed. So that is why this is not something that one agency or even one country can do, because you need industry partnership, you need academicians, you need doctors, you need epidemiologists, you need global agencies like WHO, NIH and CDC, ICMR, the African research agencies, all on the same page in order to address these effectively. And I think the world has realized that this is necessary, and many consortia are now in development to work on these kind of issues. So again, I think this is of huge importance and interest to both Africa and India. and it makes sense for us to do this type of planning and preparation together.